So, we have experienced a number of waves in this pandemic, and unfortunately, we're now in the midst of a fairly large surge that is related to a number of factors, including the Delta variant, which is a highly transmissible variant. In June, we had reached a low at one point of less than 12,000 cases a day being reported as a 7-day average. Um, right now, we're at nearly 150,000 cases a day being reported. So, a pretty huge change over that time period. The average number of new hospital admissions is up over 12,000 right now. And we're having about 1,000 deaths a day reported to CDC from COVID-19. In total, there have been almost 640,000 deaths reported and nearly 40 million cases reported. So, this pandemic continues to take a major toll despite the availability of proven mitigation measures and very effective vaccines. So, through this surge over the summer, particularly in July and August, we've been tracking all of the cases, emergency department visits, and hospitalizations, but are particularly concerned about children and looking at the burden on children of this disease. And we are seeing, similar to what we're seeing for the whole population, increasing proportion of emergency department visits in children that are COVID-19 related during this time, increasing new hospital admissions. And importantly, we can divide the states up by vaccination coverage level and see some important trends where those states that have the highest levels of vaccination coverage have the lower rates of emergency department visits and hospitalizations in children. And conversely, the states that have the lowest vaccination coverage have seen the greatest increases in emergency department visits and hospitalizations in children. And I bring this up because it really emphasizes the role that the community can play in protecting children. So there is no vaccine authorized for children under 12 right now, but we can all do our part to protect children by vaccinating as many people as possible that are age 12 and over and using other mitigation strategies like wearing masks to reduce transmission. So through those efforts, we can really protect children even now before there's a vaccine available for them. So just want to end today with a plea to everyone to work together to implement those prevention activities across the community so that we can reduce community transmission and also make sure that we can keep our schools safe and open for our children.